I'm Dr. Nitesh Karnire, consultant cardiologist from Chambers Clinic and Diagnostic Center. Majorly when we have lot of confusion, what is angiography and what is CT angiography? So angiography is a test which is done in the cath lab. A small catheter is put from the hand or the groin and then images are taken in the cath lab. The other procedure is CT coronary angiography. CT coronary angiography is a test which can be done in diagnostic center. No need for admission for this procedure. In this case, contrast is just injected in the hand and then images are taken in the CT machine, just like how normal CT scan is taken. So if you see the procedure, CT coronary angiography uses a CT scanner to create an images and detect the blockages. In case of coronary angiography, a catheter is put in the heart and then images are taken in the cath lab machine which can be seen. And CT coronary angiography does not require any catheters to be inserted in the body. And on the other side, coronary angiography requires catheter to be inserted in the body. So what are the uses? CT coronary angiography can detect if any blocks are there in the heart vessels or not. In coronary angiography, we can detect any blockages there in the heart or not, and if we detect any blockages, it can also be treated at the same time. So if you see, CT coronary angiography can be used only for a diagnostic purpose, and coronary angiography that is done in the cath lab, that can be used for both diagnostic and for treatment purpose also. If you see the recovery time, CT angiography, just a dye is injected, you take the images and you walk out of the diagnostic center. But in coronary angiography, which is done in the cath lab, the patient will have to wait in the hospital post procedure for about 3 to 4 hours and then the patient is discharged. If you see the risk, CT angiography has a much lower risk compared to coronary angiography that is done in the cath lab. And the accuracy, if we see, CT coronary angiography is less accurate when we compare with coronary angiography. Coronary angiography that is done in the cath lab is considered as the gold standard for detecting any blockages in the heart. Both involves some radiation exposure. Radiation exposure involves X-rays which causes some sort of radiation exposure, but can be accepted within a normal limit and not much to worry about radiation in this case. CT coronary angiography is ideal for patients with the lower risk factor or intermediate risk factor. Sometimes we have some chest pain and we are not sure whether it is a cardiac chest pain or non-cardiac chest pain. In this case, CT coronary angiography is better because it has a lower risk profile. On the other side, coronary angiography that is done in the cath lab, that is advantageous when the patient is having chest pain or the patient is having a heart attack. In this case, the patient needs to go immediately to the hospital and get a coronary angiography done, because coronary angiography is a test which has more accuracy and it detects the blockages more accurately compared to CT coronary angiography. And once we do an angiography in the cath lab, the patient can be taken up for angioplasty at the same time. So in those patients with high risk or who is having with severe chest pain or who is having heart attack, always the angiography done in the cath lab is preferred over the CT coronary angiography. Thank you.